Dr. Robert Murphy is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Doctor, thanks for being with us.
Hey, good morning.
All right, so it looks like they want full reopening in Illinois by June 11th. What do you think of all that?
Well, it's pretty aggressive opening schedule, but, we are checking the numbers every day. And, if this backfires, we go backwards. So, people still have to be careful, but let's see what happens.
If we achieve 70% immunity by September, what does that mean for a possible winter surge?
Well, that's a good question. Nobody really has the answer to that. The estimates now to really control this pandemic is higher than 70%. 70% is good, but we may need 80, 85%. We don't know. So we're going to have to see, but we better wait for if it doesn't get up high enough, there is going to be another surge this winter, that's for sure.
Let's talk about India again. They've had another huge surge in numbers there. What does this mean for the rest of the world and how India is being affected with the variants there?
Well, it's, they have their own variant there, which is making things worse. It's a huge population, very densely populated country. But the point is, it's a pandemic all around the world. We have to do whatever we can to get vaccination rates up everywhere, globally, worldwide, every country, or this thing is not going to go away. There's just too much movement of people and commerce, and it's just, we have to look at this from a worldwide perspective.
Before we get to viewer questions, real quick, there's a study that says COVID deaths in the United States is much higher than what is being reported. Why do you think that is? And can you address some of the conspiracy theories we discussed before where people feel like everybody's being labeled COVID even when they don't have it for nefarious reasons?
Right. No, I mean, the argument goes both ways. Too much was COVID, too little was COVID. I think if you ask any epidemiologist, anybody who really studies how you measure these kind of endpoints, number of cases and deaths and whatever, they would say that it's underreported. That is what the experts really think. The question is, how much underreporting is it? And so this the group at the University of Washington here has revised their formula and come up with a number that's 57% greater. I think it's more realistic than what has been reported already, frankly. There's arguments both ways, and remember that they are models, but we do it with other diseases. We do it with cancer all the time, we do it with heart disease all the time, we do it with neurologic problems, strokes and whatever. It's done with other diseases. This is nothing magical. It is science, and we're only as good as the model, but I really think there are more cases, and I think this is a realistic number.
All right, viewer questions now. Yesterday, Dr. Murphy said if somebody had the vaccination and then bumped into someone with COVID, they wouldn't need to quarantine and will not get COVID or pass it along. But I know 3 people that had the shot and then got COVID. One 4 weeks after the shot, one 6 weeks after. Neither had to be hospitalized. How do you explain that?
Yeah, no, this actually all happens, just like this person said. Let me explain it. If you have had the vaccine, you're fully vaccinated, you had your 2 shots and you're 2 weeks after the second shot, you don't have to quarantine anymore. The data are clear. You're at very low risk, even though you've had contact with a person with known COVID. Now, once you have the vaccine, remember, the vaccines are not 100%. But they are 100% or closer to 100% for preventing severe disease and hospitalization and death. It's markedly lower. So there's about a 10% failure rate with the vaccines. So you're going to see people get COVID, but in general, it's going to be very mild. And this no quarantine comment, back to the first part of the question, it's only for asymptomatic people. If those people get any kind of symptoms, of course, they have to go get tested.
Yeah. All right, next question. Is there any data on how reliable the current COVID tests are in relation to variants? Seems a lot of people I see have all the COVID symptoms but are testing negative.
Well, a couple things here. tests that we have now, we believe work fine for all the variants. That is not going to make a big difference. But we'll see in the future if that changes, but most likely not. But I think the question is pretty clear that the tests work even with the variants.
I got the Pfizer vaccine, and in a year, when and if we need a booster, do I have to stick with Pfizer exclusively for that booster, or can I still take what's available?
Yeah, it really depends who develops the booster and what the booster is for. But you're not stuck with the company booster that you started with. That's for sure, because one of them may come out with a super duper booster that works for the India variant. Some may have the variant from South Africa, or the one in New York, or the one in California, whatever, or some combination of them. And these mRNA vaccines, the Pfizer and Moderna, are very easy to tweak. They're very easy to make them work better for the different variants. So you will not necessarily have to take the same booster from the company you started with.
Okay, last question. Yesterday, Dr. Murphy's answers broke into new ground, and very successfully. Besides COVID, possibly one general family health question every day?
I did train in internal medicine, but I've been pretty much just doing infectious disease work. So
Well, you were dipping into relationship advice yesterday too, so that's a whole nother branch for you.
Yeah.
We do want to keep you around, so all right, we'll put that on the table.
I'll have to get a new career going when this COVID thing gets over. Let's just hope COVID gets over.
Yeah. Thanks, doctor.
Doctor.
If you have a question for the doctor, you can post it on our Morning News Facebook page. We'll talk to him again on Monday. Paulie?
Hey, good.